Okay, my name is Dr. Jim Kokkinakis. I'm an optometrist in the Sydney CBD, and I'm also a senior lecturer at the University of New South Wales in the optometry school.
How many people come and see you every week suffering from CDS?
As far as numbers are concerned, we probably see about 80 patients per week, and at least half of those have computer vision syndrome.
That's a high proportion. I guess that's because you're in the Sydney CBD?
Yeah, that's one of the reasons, but I think it's also because I've taken a special interest in computer vision syndrome, and over time people seem to have sought out our practice.
So what is your advice to people who come and see you with computer vision syndrome symptoms?
Well, you really need to think about where the problem starts from, and it starts in your office in front of a computer screen. So there's all sorts of things like ergonomics of the situation, plus what computer screen you're using, taking regular breaks, even blinking exercises. Having the correct pair of glasses, of course, is critical to making sure that we minimise the impact of this condition.
So is there one computer screen that's better than another for our eyes?
Yes, I think there is. BenQ has incorporated a new technology in their computer screens to eliminate flicker and reduce the emission of blue light. And I think that that's a great option.
Is it something you talk to your patients about, upgrading their computer screens?
All the time. In fact, I've been using a BenQ flicker-free monitor now for the last 3 months, so I believe in it.
You found a discernible difference?
No question about it.
You do suffer a sufferer of CDS?
I sure am. I mean, you can see my glasses. I wear glasses, and I do a lot of reading, and consequently, it's imperative for me to be able to concentrate all day and absorb the information that I need to do all day.
What would your advice be to parents of young children who are using digital technology as part of their everyday life?
The first thing I'd like to do is alert them to the fact that digital technology is responsible for a significant increase in a condition called myopia. So they need to be aware of that. And the easy thing for parents to do is to let the kids play on a computer screen all day, and really we need to be mindful that it can be damaging to their very young eye muscles.
So kids' eyes are more susceptible to CDS than adults?
There's no question about it, but it also goes beyond that, because they will actually get permanent changes to their eyes, which adults really don't seem to suffer from.
So are more kids wearing glasses today than they were in generations past because of computer use?
I think it is, and in Australia, as an example, we've had as I said before, a 100% increase in the amount of children that wear glasses. But what's even more startling is if you go to Asia, where those children are made to try and learn from a very, very young age. One study in the University of Singapore showed that 97% of females and 94% of males are in fact myopic or short-sighted today, and that we feel is directly attributed to computer use.
And in rural areas where kids aren't using computers, has there been an increase in the rate of myopia?
Doesn't seem to be at all. I mean, these children in the rural areas of China, as an example, are illiterate. Therefore, they don't really read or look at a computer screen at all. And the incidence of myopia in those communities is about 2%.
And in Australia, it's?
We're probably about 20 to 25% when we look at the generation before. Today it's approaching 50%.
Doubled?
100%.
Thanks, Jim.
Thank you.